we're very, very pleased to have Dr. Sarah Myhill back with us to answer all the many, many questions from last time, as well as any new ones that you have. I'll just introduce her very briefly. Dr. Sarah Myhill, who I'm sure you all know, qualified in medicine with honours in 1981. And first of all, she spent 20 years working on the NHS and then moved into private medicine, where she's been working for over 20 years, focusing tirelessly on identifying and treating the underlying causes of health problems. So I won't spend any more time introducing her because we have so many questions today. Let me just please mention that there's a Q&A button at the bottom of the screen. So if you have any questions, please put them in there. We will begin with questions from last time and then move on to questions that came in via forums over the course of the week. So Sarah, anything else you'd like to say just to start with, or any further introduction you'd like to give?
Goodness me, no, delight to be here. Thank you for inviting me. Great privilege and far away, and I will do my best to be clear and brief and concise.
Oh, thank you very much. Okay, well, one here is that one attendee says her daughter, who has Lyme and ME, has been further set back by COVID. Although she didn't have many symptoms, her capacity has really dropped and new symptoms have developed. She believes this is partially due to lack of activity thanks to lockdown. First of all, she asks, how does COVID interact with ME, and how would you suggest recovering from a setback like this?
Okay, well, as you know, I see chronic fatigue syndrome and ME as two separate entities. And chronic fatigue arises when energy delivery mechanisms are poor. ME arises when energy delivery mechanisms are poor and there is inflammation. Now, in your case, with Lyme disease, there's chronic inflammation due to an infection with Lyme. And the immune system is working as hard as it possibly can to deal with that. And when the immune system is activated in the business of dealing with an infection, that causes nasty symptoms. You know, the cardinal symptoms of inflammation are heat, redness, pain, swelling, loss of function, and they give us extremely unpleasant symptoms. Now, if your immune system is trying to deal with Lyme as efficiently as it can and not succeeding terribly well, because of course, remember, many people do get Lyme, their immune system deals with it absolutely fine, and that's the end of it, and they may not even know that they've had the infection in the first place. What it means is the immune system isn't working as well as it could. And if you get another infection on top of that, then you're overwhelming that immune system even more. Now, as you may know, I produced a book called The Infection Game. And the important point here is that improving the body's own immune defenses is just as important as hitting the microbe. And there are some microbes for which we don't have very good remedies for. So improving the immune defenses becomes even more important. And in that book, I introduced the concept of what I call groundhog strategies. And I call them groundhog strategies because, like the film Groundhog Day, it's a time loop. I keep coming back to these over and over and over again. And in your case, there are going to be two levels of strategy that are relevant for you. Now, we all start off with what I call groundhog basics. What we should all be doing all the time just to stay fit and well. And guess what? People don't do it because they don't make major lifestyle changes until they become ill with something. But in theory, we should all be doing groundhog basic. At the first sign of any infection, we should be using what I call groundhog acute. And key to that is high dose of vitamin C, taking vitamin C to bowel tolerance. And in the case of respiratory infections, maybe inhaling iodine as well, and making sure you've got vitamin D, good vitamin D status. And I say all these regimes are detailed in the Infection Game. And then when people become chronically ill with something, whatever that may be, chronic Lyme disease, chronic Epstein-Barr infection, chronic mycoplasma, you put in place groundhog chronic regimes. And those are the specific interventions to give the immune system the best chance of fighting that infection. And guess what the immune system needs to fight infection? It needs very good energy delivery mechanisms. The immune system uses a huge amount of energy. and therefore we have to think about all the energy delivery stuff, the diet, the mitochondria, the thyroid, and the adrenals. And then the immune system needs the raw materials to help it fight, and that's where vitamin C and zinc and magnesium and selenium and essential fatty acids are all so important. And then you need the time and the rest and maybe other interventions as well. And once those things are in place, you then know your immune system has got all the raw materials it needs to function. And maybe then we then have to start in adding in specific antimicrobials, which could be herbal. It could be things like light therapy. It could be heat therapy, which we know has antimicrobial effects. Or it may be specific prescription drugs. So for Lyme disease, there are packages of antibiotics which we know are effective, and they have a very good track record. So it's the whole package. And I would love to be able to say to you, all you have to do is take this and it'll snap you out of your current relapse. But life just isn't that simple. We have to do it all. And as I say to my patients, this is not a battle, this is a war. And it's actually a war that we all fight for life, because most Western pathology is infection driven. It has an infectious associate. So you can get rid of your Lyme, get ahead of the game with the COVID-19 and feel well. That then protects you from disease in the future. So I can say to my patients with every confidence, okay, it's hard work now. Yes, you're going to have to invest a lot of effort in recovering from the current situation, but then you will live to a grand old age and to a good standard as well.
Okay, thank you. I imagine you've answered a lot of this already, but I'll just ask it because it's a bit more granular, which is someone who says that they've had COVID symptoms and it took them over 4 weeks to recover. They still feel weak and they're coughing. They know that they've got ongoing Coxsackie and cytomegalovirus infections suppressing their immune system, causing lymphadenopathy and brain fog, dizziness. Is there anything more specific you would recommend, or is it really exactly what you've just described?
It's those things that I've said. There are 1 or 2 tools that are very useful. There's a product called BHT, butyl hydroxytoluene, which is effective against all lipid coat viruses. And that may be a useful tool. But another tool that I'm using or learning about as we speak is called microimmunotherapy. And that is a homeopathic technique which has got some very good clinical trials demonstrating efficacy, and it's licensed and registered in Belgium, for example, for use with a range of conditions. Because what's happening with these chronic infections is the immune system, yes, it's fighting hard to deal with these infections, but maybe part of that immune response is rather inefficient. And it seems that these microimmunotherapy techniques kind of almost train, I think of it as reprogramming the immune system to work more efficiently and in a more targeted way. And so there may well be a case for using microimmunotherapy for cytomegalovirus, for example. And one of the things I'm trying to do is make this available to everybody. And if you go to the website I've set up, which is free, called Natural Health Worldwide, where you can access any health practitioner in the country, and I've set up a system whereby any of those therapists can access microimmunotherapy through myself. So we're just starting with this scheme. It seems to be going very smoothly at the moment, and we're getting some good results back. So that would be something that's well worth considering. More information on my website, just go in to drmyhill.co.uk, put in microimmunotherapy in the search bar, and all my information on that comes up.
Fantastic, thank you. Another here who has had COVID viral symptoms for over 100 days. She says, what can I do to heal COVID-19 gastro symptoms? And also she wonders, is there an autoimmunity fallout from COVID-19? And if there is, what can you do about that?
At the moment, we don't know if there is an autoimmune fallout from COVID-19. We do know that many viruses will trigger autoimmunity. And of course, the worst offender is Epstein-Barr virus, which is associated with about 33 or 36 different autoimmune conditions that we know about. But when it comes to the gut symptoms, I have a very simple approach to treating the gut. And the 2 common issues that drive gut pathology are firstly allergy to foods, and secondly fermenting gut problems, as I call it. And again, the starting point to treat that is first of all do a paleo-ketogenic diet, because the major allergens are the grains and the dairy products and yeast, so cut those out of the diet ruthlessly. and then take vitamin C to bowel tolerance. Because if there is a presence of COVID-19 in the gut, I'm assuming this, then it will contact kill that as well. It's a wonderful tool. It contacts kills all viruses, all bacteria, all fungi. It's extremely safe. It's free from side effects. It has other multitasking benefits, and it's cheap, and everybody can access it. And again, the details of how you can use vitamin C to bowel tolerance on my website in the book. But that would be the starting point.
Thank you. I have sarcoidosis and COVID-19. Any special advice, or is it just groundhog chronic?
I'm a great advocate of as the American Army put it, the KISS principle. Keep it simple, sweet. And there are 4 major prongs, all of which are of proven efficacy in the treatment of COVID-19. And those 4 things, the first of all, cut the sugars and the carbohydrates out of the diet. In fact, a colleague of mine is working in an NHS hospital, and they have had 38 cases of COVID-19 which required hospitalization. He said all 38 cases had a BMI above 30. They were all overweight. They're running their bodies in sugar and carbohydrates. And the 8 patients who died, they all had a BMI above 34. So start off by doing a paleo-ketogenic diet and cut out the sugars and carbohydrates. That's number 1. Secondly, vitamin D. Vitamin D is now so important. And I dug out, there's a study here by Dr. Raharasan, and what he showed, he looked at vitamin D levels in patients with severe COVID. And essentially, if your level of vitamin D in the blood was less than 17 nanograms per mil, the mortality was almost 100%. At 27 nanograms per mil, the death rate starts to fall very rapidly. At 37 nanograms per mil, the death rate from COVID-19 was 0. There's a very, very clear straight line relationship between the levels of vitamin D and the death rates from COVID-19. So get your vitamin D up. Now, the bare minimum we should be taking is 5,000 international units every day. That is equivalent to half an hour of sunbathing every day. It sounds like a big dose, but it isn't. So my view is that's the bare minimum that you should all be taking. And this vitamin D idea explains why Black and Asian doctors have a very high mortality from COVID-19 compared to white doctors. So vitamin D is vital. Vitamin C, the same. Again, the dose of vitamin C should be 5 grams every day minimum. Now, put it in a bottle of water, drink it little and often through the day. 5 grams, that's 5,000 milligrams. And again, there have been some fantastic studies in Wuhan and in New York, intravenous vitamin C, up to 10 grams intravenously over 24 hours, and maybe some more. The mortality from that has been 0. The side effects, 0. The cost, $12 a day. So vitamin C, by mouth, and taken to bowel tolerance little and often through the day, is as good as intravenous. You don't think, oh, I've got to have the intravenous stuff. Take it properly by mouth and you get just as good a result. And then a fourth, of course, is iodine. And iodine contact kills all microbes. There is no microbes that's resistant to, and hence it's so beloved by surgeons. And so when you come away from your operation with yellow all over your scar, that's because it's iodine. And so iodine, on your hands. So what I recommend people do is they use coconut oil, 10 parts coconut oil, 1 part Lugol's iodine to make a slightly yellow gloop. And for any foreign contact, just put it onto your hand, rub it onto your face. And if you have any hint of COVID-19, then inhale iodine, salt pipe, a couple of drops of iodine in the top of it, like that. Hold it like that and sniff it. If you can smell the iodine, you're getting a therapeutic dose. And when you sniff it, you coat the whole of the airways with a very low level of iodine, which, as I say, contact kills in seconds. So the point here is, with those 4 interventions, cut out the carbs. Vitamin D, 5,000 IU daily. Vitamin C, 5 grams daily. And iodine, your worries about COVID disappear to nothing. You are not going to get it. You are not going to die from it. You can get on with life. And with these simple interventions, lockdown should become a thing of the past.
Okay, thank you. One person here has lost her sense of smell and therefore taste. Is there anything specific she can do about that?
Well, again, that seems to be a common symptom of COVID-19. Again, all the things that we have talked about already, but nerves are very good at healing and repairing. And the one or two that I've heard of, their sense of smell and taste has come back. You know, my daughter lives in Paris, and that was the first clue that she had had an infection with it. And with, you know, of course, I'd supplied with all the goodies she needed, and within a few days that had passed. So it's all the things that I'm talking about.
Fantastic. Thank you.
Hit it hard and use vitamin C and vitamin D to stop the inflammatory response.
Okay, thank you. A question here about wearing masks. Is it safe, or could it increase the risks?
Well, the nonsense here is we haven't really got any good studies that shows that wearing masks is protective. It just seems like a good idea. But what would massively improve the efficacy of the mask is put a couple of drops of Lugol's on the mask. Iodine is volatile, and that means that it will slowly evaporate over the day, and massively reduce any loading dose of COVID going into you, or if you're exhaling COVID, the loading dose of COVID coming out. So it's very cheap, very simple, proven efficacy. So if you choose to use a mask, or you have to, so be it, but you can greatly increase the efficacy of that with a couple of drops of iodine.
That's super. That makes a lot of sense. Thank you. Someone here asking, in fact, several questions about Hashimoto's and the use of iodine. They've read that or heard that it can be contraindicated. What's your approach there?
The first point is being iodine deficient is a major risk factor for Hashimoto's thyroiditis. So, you know, I cannot see how it means that giving iodine will somehow make the Hashimoto's worse. But what does happen is if you have somebody whose thyroid is not working properly because it doesn't have enough iodine to function normally, when you then start to normalize their iodine, the thyroid may temporarily go into overdrive and produce, almost too much iodine. But it's a short-lived effect. It's too many thyroid hormones. It's a short-lived effect. The body quickly works it down. It downgrades production, and it's normalized. And my view is that it risks problems of giving iodine to somebody with Hashimoto's have been enormously overhyped and blown out of all proportion to the clinical issues. So I have to say I don't have any concerns at all about using iodine in Hashimoto's. In fact, it's desirable.
Okay, thank you. Someone here who's heard about melatonin from other specialists in the field and just wonders whether that's something we can even risk talking about in the UK, where it's not permitted apart from I think one particular NHS approved type. You prepared to say anything about that?
Well, of course, the best source of melatonin of all is your own. And to stimulate your own melatonin, you need lots of sunshine in the day, and you need a nice black dark bedroom, by night. And that will stimulate your body's own melatonin. So do that before you think of doing anything else. But yes, we know melatonin has all sorts of antioxidant, anti-inflammatory, anti-cancer benefits. And, again, it's biologically plausible that it may be helpful to prevent COVID-19. And guess what? We know sleep is protective against a whole range of pathologies. But, let's get it in proportion. Compared to those four basic things, it fades into insignificance. So keep it simple, sweetheart. Think of the KISS principle. Do those four things well. They're cheap, simple, easy, available, and free from side effects. Anybody can do them. Do that, and you will be as right as rain.
Okay. Well, this is probably not so relevant then, but somebody is asking about glutathione, I think partly because Dr. Horowitz focused on that a lot last week. So what's your approach to glutathione? Do you think it's necessary? It is expensive.
Glutathione is something that I use a lot of. I love to use it. I don't think it has to be any fancy liposomal levels formulation, because blood levels come up reliably well with good old bog standard glutathione 250 milligrams daily. But it's another very useful multitasking tool. It's essential for glutathione peroxidase, which again is essential for normal thyroid function, normal immune function, and it's also essential to help detox heavy metals and other such nasties. And the fact of the matter is we live in a poison polluted world. You know, okay, I do my best to avoid those things. I do my best to avoid heavy metals and try to eat organic when I can. But whether we like it or not, we're all a bit poisoned. And glutathione is one of those things that helps us to reduce the toxic load. And it's actually part of my groundhog chronic regime. You know, as we get older, or indeed with any pathology, arguably we should all be taking glutathione all the time.
Okay, thank you. One person here asks if you could repeat the recipe for inhaling iodine with salt, but I think we can probably refer people to your video, can't we, on
yes,
the viruses and iodine.
One of my lovely patients, Sean James, regularly comes down and we do little video clips. So if you go to YouTube and put in Life the Basic Manual, Myhill, you'll see there's a whole range of clips come up with the making bread and the PK diet and the infection game, the groundhog regimes. You know, she's done lots of them, and you know, they're short, sharp, and snappy. So hopefully you can pick up some gems from that.
Thank you. What can I do to mitigate the risk from taking ACE inhibitors? Should I come off them?
Well, first of all, you know, you're on ACE inhibitors for a reason. So, as a doctor, my first question was, why are you on ACE inhibitors? Now, if you're on ACE inhibitors because you've got high blood pressure, then you need to do the paleo-ketogenic diet. And, you know, I would expect your blood pressure to come down on the paleo-ketogenic diet. As soon as you get into ketosis, you stop wobbling your blood sugar. As soon as you stop wobbling your blood sugar levels, you iron out your insulin levels and you iron out your adrenaline levels. And it's the spike in adrenaline that causes the blood pressure. So I daren't advise you to stop the ACE inhibitors now, because I don't know why you're taking them. You'd want to explore that first. You know, if you want more information, I've just produced another book called Ecological Medicine, which is the Bible of, you know, the whole of medicine, and you may well find clues in there. But I know you have asked this question because what we do know about COVID-19 is it attaches on cells via those very same receptors, and therefore ACE inhibitors, it's theoretically possible and biologically plausible that they may increase your risk of COVID-19. But back to basic. Keep it simple, sweetheart. Basic 4 principles. Compared to those 4 things in place, the ACE inhibitor story fades into insignificance.
Does anemia increase susceptibility to COVID?
No, it's not like that. It's the other way round. And this is what's so fascinating about COVID-19. In this respect, it behaves like the malaria parasite. Because what it does is, once it gets into the bloodstream, it attacks hemoglobin and it splits iron off it. And that causes 2 problems. Now, first of all, if the hemoglobin hasn't got iron attached, it can't carry oxygen. And what's so fascinating is that clinicians are seeing patients coming in, you know, who look fairly okay, who don't have respiratory distress, and they do their oxygen saturations, and they're very low. They're, you know, 80%, 70%. You know, they need, you know, oxygen urgently. So that's the first problem. And the second problem is it splits iron off. Now, iron, when it's not attached onto ferritin or lactoferrin or hemoglobin, is a very dangerous molecule. It causes massive pro-oxidant stress and stimulates the immune system, and it's probably iron that is the center of the cytokine storm that we see in patients with COVID-19 that actually kills them. And again, this is where vitamin C is so fantastic. It grabs that iron and mops it up and pulls it out the way straight away. And this is probably part of the mechanism by which vitamin C is so effective in very severe cases of COVID-19. It stops the cytokine storm and allows the patient to recover. It stops the cytokine storm and it kills the virus, so the anemia can then recover.
Thank you. Is vitamin C in high doses safe for individuals with hemochromatosis?
Well, that's a very good question, and at the moment I don't know the answer to that. And the reason the question has been asked is because vitamin C enhances the absorption of iron, but at the same time it also enhances the excretion of iron. So it's a question of, you know, where does that balance lie? What I have got a patient who I'm dealing with as we speak who's in this dilemma, and what I'm saying to him is, take the vitamin C. You know, the hemochromatosis we can deal with in the short term. If you get a very high hemoglobin or very high iron, then yes, we can do phlebotomy and reduce that quite easily. But vitamin C, you know, at this time is a very important defense against COVID-19. So I've advised my patients to take it and see what happens. It may be that on balance, it pulls the iron out of the body as effectively as it enhances the absorption of. It may be on balance that it's doing good. So watch this space, don't know, monitor and see.
Okay, thank you. Does taking a vitamin D supplement reduce your body's ability to produce it from the sun?
Not in the slightest. In fact, the way that the body makes vitamin D from sunshine is brilliant and safe, because when the vitamin D levels are very low, it makes vitamin D very rapidly. And once the body is saturated and has optimum levels of vitamin D, it shuts down vitamin D production. So you could argue that sunshine is the safest way of taking vitamin D, because you can never overdose with sunshine and get vitamin D toxicity. If you take vitamin D, in theory, yes, you could become vitamin D toxic, but you'd have to take an awful lot of it. Now, I like people to take at least 5,000 IU daily. We know people taking up to 10,000 IU daily. There's never been any toxicity whatsoever. There's never been any problem. There are many physicians who use vitamin D in much higher doses, in 50,000 or 100,000 international units daily. And in that event, yes, you have to keep an eye on the serum calcium. But the fact of the matter is, they very rarely run into problems. So my advice, is at least 5,000 and maybe 10,000, and then sunshine take as much sunshine as you like on top of that, and sunshine will bring you to the optimum, best possible level. And guess what? I do.
Thank you. This is a patient who's been suffering for quite some time with ME/Lyme and is on antidepressants, duloxetine and clonazepam. And the question is, could they make you more susceptible to COVID-19? It's probably rather a difficult question.
Well, of course, we don't know at this stage of the game. But I would be asking the question, why do you need those drugs? Because all drugs have the potential, many drugs have the potential to inhibit mitochondria. And of course, mitochondria are central to energy generating mechanisms. To a certain extent, those drugs are symptom suppression, because the brain, when people are very fatigued, when their energy levels are so poor, the brain gives us symptoms to stop us spending energy. Because if you overspend energy, you risk serious pathology. So the first thing I'll be asking is, why are you taking those drugs? Now, yes, sometimes I do prescribe those drugs. And the number one reason to prescribe them would be for sleep disturbance. And the deal I have with patients is I will use those at night in order to improve the quality of sleep, in order that you can put in place all the other interventions necessary to recover, in order that then you won't need the drugs. So, I like to think I'm using those, as a temporary solution to allow people to get better. Oh, I can't hear you, Gillian.
Sorry, I'll discontinue asking the previous 63 questions that have come in. We may need to have another session to go through those, because a lot have come in live today as well. So I may go back to them afterwards. So these ones are ones I haven't read previously, but I'll just ask them sort of in sequence here. I'm being told that it's much better to take liposomal vitamin C gel, as it's more potent than ascorbic acid. Is this true? I believe it's used for cancer patients too.
Well, I haven't yet to find a good evidence base that tells me that that is the case. And what stops many of my patients getting better is simple money, because all these interventions are expensive. So what I like for my patients is the cheap, cheerful things that they can afford and they can do and continue in a sustainable way. Ascorbic acid, good old bog standard vitamin C, has got a record of efficacy going back many decades. We know it works. So, if it works well, why change it? Why try something that's 10 times the price? And okay, there's a theoretical reason why it may be more helpful. We don't know it's any more helpful than good old bog standard vitamin C. So, for the cheap and cheerful, do the things that are affordable and doable and sustainable.
Okay, thank you. Are people with vitiligo more at risk of COVID with reference to their low immune system?
I don't think so. No, I can't imagine that would be an issue. they should be able to make vitamin D just as well as anybody else with own skins. So no, I wouldn't consider that a risk factor. I would just say, you know, do the 4 basic interventions and you'll be as right as rain.
Okay. I'll just read this, even though I haven't had time to absorb it myself. Is the worry about COVID eliminated by following these steps, even for those who are at high risk? For example, CLL in remission. That's chronic lymphocytic lymphoma, I believe.
Yeah, chronic lymphatic leukemia. Yeah, absolutely, absolutely. And in fact, you know, I've now got 3 patients currently with chronic lymphatic leukemia on all these regimes, and they are feeling as right as rain, and their white cell counts are coming down. So, you know, and in fact, there's one, if you did the test, you wouldn't believe that it's possible they could have a leukemia. So all these interventions are highly effective at treating cancer. The big 2, of course, are, you know, what makes cancer cells different from human cells? Cancer cells can only run on sugars and carbohydrates. So what do? You starve them out by doing a ketogenic diet. Having starved them out, you then take vitamin C to bowel tolerance. Now, vitamin C looks biochemically very similar to sugar. In fact, you know, other mammals can make their own vitamin C from a simple sugar. Humans cannot do that. So if you then saturate the body with vitamin C, the cancer cells see the vitamin C, they think it's sugar, they absorb it, but of course you can't make energy from vitamin C. It's not the energy molecule, and it kills the cancer cells. So it's a very simple, biologically plausible principle, which has been known since the 1930s, that this is an effective treatment. So, you know, do it all and get rid of the cancer at the same time. Yeah, that's a jolly good double whammy, that is.
Okay, thank you. Several people are asking, will they be able to get the recording of this lecture? Yes, it's being recorded. It will be put up on our website under events, and just look please for the COVID-19 recordings, and also we'll send it out with notification of the next lecture. So it will be attached to the same invitation that you get in about a week's time. Also, people are asking where they can find more details of your suggested protocols, and I'd just like to mention your NHS Doctors on the Front Line website. So we'll put a mention of that at the end of this video, perhaps across one of the pictures, you know, across an image right at the end of this video, and also under your recording. So another question here would be long-term daily use of iodine, e.g. in the mask, in the coconut cream. Could it affect negatively our natural friendly bacteria in the nose, skin, etc.?
Well, there are some bacteria there, but it's not quite the same as the gut microbiome. So it might knock the numbers back a little bit, but it's not going to eliminate them. Because they're at home there, they're naturally present there, and there they're going to stay. I mean, in some cases for chronic sinusitis, it's actually highly desirable to eliminate them. So I really don't buy that as a problem. The amount of iodine you need is just enough to smell it. It's, I know, we're not looking to take so much that it burns and irritates the nose. Just enough to smell the iodine will give you a therapeutic dose. So no, I absolutely don't see that as a problem.
Thank you. Any links between beta thalassemia and COVID that you know of or can imagine?
Not that I'm aware of. I can't imagine, I can't think how that would make one more or less susceptible to COVID-19. So we'll just have to wait for the science to come out and see if that is impacting in any way. But as I say, you know, use those 4 basic principles. You know, to keep it simple, and you'll be absolutely fine.
Okay. What level would you expect oxygen saturation to be, and at what level should one take action?
Okay, well, you know, the oxygen saturation should be, you know, 99, 100% in a normal person. And a very useful test for your oxygen saturation is the Roth breathing test. Now, details of this are on the National Health Service Corona on the Front Line website. But let me show you how to do the Roth breathing test. It's very easy. You take a deep breath and you start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I can get to 30 very easily, and without taking another breath, I can go on talking. So that means I've got good oxygen saturation. Okay, If you're in any doubt about it, you do the same thing. And if you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you have to take another dose, another breath, then that tells me your oxygen saturations have dropped to 95%. If you do the Roth breathing test, you go 1, 2, 3, 4, 5, 6, 7, and you have to take another breath, your oxygen saturations are 90%. And at that point, you need oxygen, you need doctors, you need hospital treatment. So it's a very useful do-it-yourself-at-home test. It's a sort of test that GPs are using over the phone when they're speaking to patients to assess how ill they are. And if they can take a deep breath and count to 30 easily, then the oxygen saturations are fine.
Any comments on the impact of COVID-19 on mood? I know that, again, Dr. Horowitz, when he spoke, talked about doctors, even in Russia, who'd jumped off buildings, had suddenly developed suicidal thoughts. This is a question that's obviously very disturbing. It's a patient who's in a similar situation, having previously been very fit in his 30s, and is now flawed energy-wise and mood very, very low.
Okay.
Is there anything beyond what you have said that one could sort of consider adding in here? Though I know everything's always very tailored, so it's a bit of an ask here.
Okay. Well, what we have to ask is what is low mood all about? Now, remember, we have a certain bucket of energy to spend in a day, and we can spend that in lots of different ways. Now, this bucket of energy, if we spend more energy than we have in our buckets, we die, because we don't have the energy for the heart to work, for the brain to work, for the gut to work, and so on. So the brain cannot permit us to spend more energy than that which is available. And in order to do that, it gives us nasty symptoms. It gives us physical symptoms, it gives us mental symptoms, and it gives us emotional symptoms. The physical symptoms are obviously fatigue. We feel very tired. We get muscle aches when we try and do anything. The mental symptoms are we can't use our brains. We can't multitask. Our memory goes. We can't problem solve, and so on. We procrastinate. And then we have emotional symptoms to stop us spending energy. And those emotional symptoms are low mood and depression. Because what happens with low mood and depression? You want to curl up in a ball. You don't want to go out and socialize. You don't want to make any plans. You don't have any horizons. So that low mood is simply the brain protecting you from yourself. If the brain gave you the mood of being, oh, let's go and have a jolly time, you'd use up all that energy and you'd drop dead. So as soon as my patients realize that low mood is actually simply a protective mechanism that's protecting them from themselves, and we can then focus on improving energy delivery mechanisms, and then they get right. Their energy comes back, the mood lifts, suddenly they've got a future, suddenly they've got a horizon, and they don't need to go and do something, precipitous like jump off a building. So if you understand why that low mood is there and realize it's a window of time, you will recover, you will get better. You've just got to hang on in there and put all these interventions in place, and you'll be as right as rain.
That's fantastic. Thank you. One patient here who says she suffers from acidity when she takes high doses of vitamin C. Is there any reason for this?
Okay. Well, my guess is she's not ketogenic, and my guess is she's got a fermenting gut. And yes, vitamin C can give symptoms of acidity in that event. Now, as I say, ascorbic acid is the best and the cheapest form of vitamin C, but you can easily neutralize it by mixing it with bicarbonate of soda. Most people have got bicarbonate of soda in their pantry, and the recipe is weight for weight, 2 parts of ascorbic acid to 1 part of bicarbonate of soda. It will fizz, and that will then give you sodium ascorbate, which you can then is neutral, and you can use that just as you would use ascorbic acid. So, but that lady, you need to do the paleo ketogenic diet. You've got an upper fermenting gut. Cut out those carbohydrates.
Well, this is probably related. She says, can you suggest a way I can come off 15 milligrams of lansoprazole a day prescribed to me for indigestion and acid reflux?
Well, what you have got is you've got what I call a half acid stomach. Now, the stomach should be very acidic, and we need a very acidic stomach to digest protein, to sterilize it, to clean any bugs that we might inhale and swallow or eat, and to absorb minerals. And that's a vital part of immune defenses and digestion of protein and absorption of minerals. And in order to achieve that, the lining of the stomach produces hydrogen ions and is constantly producing acid. And the plug hole of the stomach is the pyloric sphincter. Now, that pyloric sphincter is shut, and it will only open when the stomach is sufficiently acid. So what happens when you have a meal? You have a meal, and the acid that's in the stomach is immediately diluted. The pyloric sphincter remains tight shut. And it takes about maybe an hour or 90 minutes for all the acidity of the stomach to build up, to digest the food, to absorb the minerals. Then the pyloric sphincter opens and empties. Now, if you've got a fermenting gut, that stomach lining is slightly inflamed. And what that means is that as fast as the stomach pumps hydrogen ions into the lumen, they leak out. So you haven't got a properly acid stomach, you've got a half acid stomach. And what that means is that the plug hole won't open because the stomach is only half acid. But the stomach says, come on, time to empty now, goes into contraction and squirts acid contents, or rather half acid contents, up the esophagus to cause reflux, heartburn, and so on. Now, what those wretched drugs do is they give you a zero acid stomach. So, okay, you don't get the burning, but guess what? You're not sterilizing your food. You're inviting infection in. You're not digesting protein. So that's bad news. You can't heal and repair. And you're not absorbing minerals. And that's bad news. So did your GP tell you that taking that drug is a major risk factor for osteoporosis? Probably not, but it is. It's also a major risk factor for stomach cancer because you can't sterilize the gut. So that drug is really bad news. Now, the answer to this is treat the fermenting gut. What does the gut ferment? Sugars and carbohydrates. It's back to the paleo-ketogenic diet. And then vitamin C to bowel tolerance to kill any residual microbes that may be there. And then you can stop the omeprazole with no problem whatsoever.
Okay, thank you. Yes, that was lansoprazole. Omeprazole works in a very similar way, doesn't it?
Same thing, same thing.
Yep, yep. One listener here says she had an anaphylactic shock when given iodinated contrast dye. Will using an iodine pipe possibly be dangerous for me?
There is the whole world of difference between medicinal iodinated compounds, injected IV, and iodine coming in from the outside world. So yes, you must never have contrast medium again because those sort of reactions kill people. So, but it's possible you will get away with topical iodine, and the way to do it is to put some iodine, a couple of drops, a little drop of Lugol's on your arm, and see what happens. And as long as you don't get any itch or rash or swelling, you should be all right. To be safe, you want to use dilute Lugol's. But just because you had a reaction to the radioactive one, the intravenous one, doesn't mean that you will be allergic to iodine otherwise. Iodine is an essential mineral. If you had no iodine, you would be dead. Iodine is so important. So start with a little dose and build up gradually so the immune system learns, oh, okay, I've seen that before. Oh, that's not causing me any problem. Okay, we can ignore it.
What percentage of iodine solution do you use? Does it have to be 15%?
No, it doesn't have to be 15%. It can be 12%, it can be 6%, it can be 3%. But obviously, if it's a bit weaker, then you need to use a bit more of it. But the key with the salt pipe is if you can smell it, it's there in a therapeutic dose. And in fact, some of my patients find they don't have to put iodine every time because they can, in fact, I can smell mine from the previous application. So it does stay it's slightly yellow on the inside, but that's just what iodine does.
Yeah, another question about iodine. Is it okay to use it even when you're being treated with thyroxine and porcine glandulars?
Not just safe, totally desirable. If anybody needs thyroid hormones, they will be iodine deficient. In fact, these days, I rarely use iodine testing to see if somebody's deficient or not, because I know what the answers are going to be. And iodine has widespread application. We think it's just important for the thyroid, but it's also vital for normal immune function. It's vital for normal breast function. Anybody who's had a history of cysts, that's typical of iodine deficiency. It's vital to make the love hormone oxytocin, and therefore it may well have application in autism, for example. So iodine is an essential mineral, and it's very easily excreted. It's as easily excreted as chloride, so you can't get a toxic dose. It doesn't build up in the body and cause problems. It's, in fact, in the business of being excreted, it will pull out toxic metals. So it's a wonderful tool. I love using it. It's cheap, safe, multitasks, and everybody can access it.
Thank you. In the case of allergic rhinitis and sinusitis and chronic throat infections, what's the best advice with regard to using antihistamines and steroid sprays? Or is just iodine, sniffing iodine enough?
Well, it's the old story. We have to ask the question why. Now, the number one causes of chronic rhinitis and sinusitis is dairy allergy. So the first thing I do is say, cut out all dairy products ruthlessly: butter, yogurt, cheese, cream, milk, the lot. Because it's often an allergic thing. Broadly speaking, food allergies tend to present with, with blockage and catarrh and loss of taste, and inhalant sensitivities tend to present with sneezing and runny nose and itching. So that might give you a clue as to what the allergen is. But number one is dairy products. Number two is probably yeast and fungi. So, again, avoid those. So if you get a runny nose after drinking alcohol, for example, that would be an obvious clue. But you can be allergic to yeast and molds in the environment, and you can have a problem with chronic fungal infection of the sinuses, which is actually very common. But you mentioned swollen glands and sore throat. For that, I would be suspicious that there's a chronic Epstein-Barr virus infection. So, if you had a past history of EBV-induced ME, then I'd be suspicious that you're getting reactivation of the Epstein-Barr virus in the glands and the tonsils of the throat. So, first of all, a PK diet, because that covers grains, that covers dairy products and yeast. Secondly, you could well just try a salt plant, just blind, and just see what that does. And if you've got a chronic sinusitis, that can be very effective for some people. But if you're getting stuck at that point, then you want testing. Have I got chronic Epstein-Barr virus infection? And of course, Armin laboratories give excellent and reliable tests. Or have I got a chronic fungal infection of sinuses? In which case, you might consider measuring urinary mycotoxins that, again, give you a good clue.
This one is probably a very difficult one to answer. What about taking propranolol? Should this be stopped, being taken for heart palpitations and anxiety?
Well, propranolol, again, it's symptom suppression, and the way to use drugs is to, control symptoms while you work out what's causing it. So, it's not a drug I like taking in the long term, because we know it blocks mitochondria, and that can cause fatigue just on its own. If you've got any history of asthma, you absolutely shouldn't be taking propranolol, because it can cause very serious airways problems. But, I do see in the short term to control symptoms are useful, but we have to ask, A, what's the cause of the anxiety? Now, the anxiety is essentially an adrenaline symptom. What is the main driver of adrenaline? And the answer is sugars and carbohydrates. Because every time you eat sugar, your blood sugar goes up, body produces insulin, blood sugar comes down, and if it comes down precipitously, the brain says, oh, I'm running out of fuel, let's chuck out some adrenaline. And so often I find people, when they get the PK diet established, they're just so much calmer, more laid back, better able to cope with stress. So my answer would be, yes, always look for the cause, always ask the question why. And these are the questions that drove me to write the book, Ecological Medicine. And I've written it in, plain English, with some jokes and some funny stories in there as well. So I hope it's an enjoyable read. But if you don't find the clues in there, tell me, and I'll make sure it's in the next edition.
It's very new, isn't it? It just came out a couple of weeks ago. Where would you suggest people buy it from? From Amazon or direct from you?
At the moment, it hasn't been officially launched. It's Amazon is on the Amazon website, but you can't get it till the end of July. It's on my website at the moment. So if you go to sales at Dr Myhill, you can access it directly from me.
Oh, brilliant. One question here, can a type 1 diabetic follow the PK diet?
Oh, not only can they follow it, it's totally desirable. Now, I don't guarantee that you will be able to stop insulin entirely, but you will certainly be able to reduce the dose. But the key here is if a type 1 diabetic is going to do the PK diet, they must go for continuous blood sugar monitoring. And there is a device called Dexcom. Now, all new children who are type 1 diabetic get given one automatically now within the NHS. But if you're type 1 diabetic, you should be able to persuade your consultant to give you a Dexcom, because that gives you minute-to-minute recordings of blood sugar levels. Because when you do the PK diet, your blood sugar levels will come down. because you're not eating carbohydrates, and therefore your dose of insulin will come down. Now, for some, if you're lucky, you may be able to come down to 0, but most people end up on a low baseline level of insulin because you're not eating the carbohydrates. And indeed, before insulin existed, a ketogenic diet was the treatment for type 1 diabetes. And if people didn't do a ketogenic diet, then they died of type 1 diabetes. And that was in the 1920s and the 1930s. So totally desirable. And yes, you must do it, but you must do it properly with proper blood sugar monitoring.
Okay, thank you. A couple of questions have come in relating to the fermenting gut that you spoke about earlier. Doesn't the gut also ferment proteins?
Only if those proteins are inefficiently digested. Now, let me just explain this. Humans are almost unique in the mammal world because they can eat such a wide variety of foods. And we can do that because we have dual parts of the stomach. So the upper gut, by which I mean the stomach, duodenum, and small intestine, should be a near sterile digesting gut to absorb proteins and fats. And then the lower gut, the large bowel, is full of bacteria, and those are the friendly bacteria that ferment fiber, and hence the base of the PK diet, which needs to be ketones, i.e. fats, and some protein, of course, which we digest in the upper gut, and then fiber is fermented in the lower gut. If you have got a fermenting upper gut because you're eating carbohydrates, then those microbes may well ferment protein to a certain extent, and that will give toxic metabolites. So that gets a thumb down. Proteins are only a problem in people doing a paleo-ketogenic diet if people eat so much protein that they overwhelm their ability to digest and absorb it. And some of it finds its way into the lower bowel, where it will be fermented by bacteria there and produce nasty gases like hydrogen sulfide, and they smell. So one of the guides to a healthy large bowel is, yes, you should fart. The large bowel, when it ferments fiber, produces hydrogen and methane, and you will fart, but it won't smell. If you put a match to it, it would be flammable, but I have to say I don't recommend that as a clinical test. But if you are producing wind, but it's offensive, then you are fermenting protein, and that gets the thumbs down. So it's a very good guide, for example, as the dose of vitamin C you need to get to bowel tolerance. Because if you have a lot of vitamin C and you overwhelm your need for it, then the food, will rush down into the large bowel, proteins get fermented, and you start to use bowel smelling. The next step, of course, is diarrhea. But, these clinical clues are useful. Use them. They're cheap. They're personal. They're day-to-day, and they allow you to get yourself on the right diet and the right route to health. Sorry, Gillian, I can't hear you.
Sorry. Another question here is, what's your view on drinking red wine in moderation, if no histamine issues? Is it acceptable?
Well, yes, I am no paragon of virtue. Primitive man was no paragon of virtue. And yes, primitive man had feast days when he saved up his grains, he saved up his fruit, and yeah, he had a wild spurt. This is all about, how often you do things. And, my view is that a bit of alcohol in somebody who's otherwise well is absolutely fine. But don't drink it all the time, because you get used to it, and then you end up with problems. So save alcohol for the weekends. And guess what I do? Yes, at weekends, I go and have a glass of wine, and I thoroughly enjoy it, and then I'm back on the wagon for the rest of the week. It may be I will come to a stage in my life when I can't do that, but I think in moderation, the body is well able to deal with alcohol. Guess what? Alcohol is a product of the fermenting gut. We have a liver enzyme dedicated just to breaking down alcohol. It's called gamma-glutarate transferase. So, we're well able to cope with alcohol, but just don't overdo things. In moderation, at weekends, no problem at all. Totally desirable.
Okay, thank you. Someone else asking how long it could take to overcome fermenting gut with vitamin C. Presumably that depends on how serious it was in the first place.
Oh, very quickly. Microbes double, given the right substrate, microbes double their numbers every 20 minutes. If the substrate isn't there, the numbers fall off very quickly. So you can sort the fermenting gut in a few days.
Okay.
Now, I have to say, the most helpful tool my patients have found with fermenting gut is a ketone breath meter, because that tells them when they're in ketosis. So instead of having to say, oh, I'm eating this, I'm eating that, I'm eating the other, they can measure it themselves. They cost about 35 quid, but you can do as many tests as you like. And the way to do it is you switch it on, and it takes 20 seconds to count down. So you watch it as it counts down. And then when it gets to 0, it's warmed up, it beeps, and you blow into it. When it beeps a second time, you stop blowing, wait a few seconds, and it gives you the results. And any amount of ketones will do. So here we go, 2, 1. Beeps again a second time. Wait for a few seconds, and there we go. There's the result. I'm in. You see, I'm in 2.8 millimoles. 2.8 parts per million of ketones. So I'm in ketosis. So I've done the diet well enough. And any reading will do. It doesn't matter if it's 0.5. It doesn't matter if it's sometimes it's 7 or 8 or 9. That is fine. You're in ketosis. Now the key here is doctors do not understand what proper nutritional ketosis is all about. And if you go to your doctor and you say, I'm in ketosis, they panic, because the only thing they have been taught about is diabetic ketoacidosis. And they will say, oh, you must go and have some sugar straight away and get out of ketosis. It's a very dangerous state. Nonsense. So diabetic ketoacidosis is only a problem if you've got uncontrolled diabetes and your sugar is in the sky as well. And yes, that's a medical emergency. But if you're doing the paleo-ketogenic diet and you're not diabetic, there is no problem with ketosis whatsoever. In fact, it's an entirely desirable state to be in. Mute, I can't quite catch you, sorry.
I'm doing that, sorry. A few rather specific questions have come in listing patients' symptoms, and so I'll attempt to kind of summarize them and make them a little bit more generic for the next time we speak, perhaps. One interesting one here. Do you think that, or have you heard that Epstein-Barr virus can cross the placenta?
I'm sure it can.
Yeah.
I don't know for sure. I'd have to research that. But it is such a nasty little virus. I mean, glandular fever is an illness that should be taken very seriously. And if I had a young person that came to me with acute glandular fever, I would throw all I knew to throw at it. I'd insist on absolute bed rest, groundhog acute, with massive doses of vitamin C and iodine, and I would start them antivirals as well. I would start one valacyclovir, because if that nasty little virus gets a grip on the body, it can trigger years, decades of ME, autoimmunity, cancer. Nasty. It's a really nasty little virus, and so it's so pernicious. My guess is it possibly could get over the placenta. I don't know that. And of course, what you have to remember is during pregnancy, mother is immunosuppressed. Mother has to be immunosuppressed because the fetus is genetically different. And if mother wasn't immunosuppressed, she would reject baby as a foreigner. And the high levels of female sex hormones that are essential to maintain a pregnancy cause immunosuppression. And that, again, would encourage any latent Epstein-Barr virus to flourish.
Understand. Well, one knock-on effect that this COVID crisis may be having is to at least raise awareness in the conventional community of ME. There was a Times editorial just yesterday with the heading, ME is finally being taken seriously just as COVID threatens an increase in sufferers. So
well,
hopefully
about time too.
Mm.
Yeah. Proper doctors, asking proper questions, have been in no doubt at all the pathological nature of chronic fatigue syndrome and ME. And this is a battle we've been fighting for decades. So that is good. But as I understand, that editorial is all about heralding new research into the genetics of ME.
That's right. It's a project called Decode ME, and actually we have received questions asking whether that £3.2 million is being well spent, in your opinion?
In my opinion, it is not being well spent, because this is not going to lead to good therapies for ME patients. We know how to treat chronic fatigue syndrome. We know how to treat ME. There's a very well-trodden path. But why aren't we treading it? Follow the money. If the cure of ME and chronic fatigue syndrome lay in some extremely expensive drugs, don't you worry. Everybody we've been beating for it, and paying for it, and the drug companies would make a fortune out of it. But the way to cure chronic fatigue syndrome and ME are simple, nutritional, lifestyle interventions that don't make any money at all for big pharma. In fact, they don't make any money at all for anybody at all. So, you know, let's spend 3.2 million on a good education program to get the message out there to people and make the difference. And you know, and my view is that's 3.2 million quid wasted, just like the PACE study. You know, the PACE study cost 5 million quid, money wasted on a useless treatment, which obviously I'm at loggerheads with the General Medical Council and the Information Commissioner to get the truth of that out. But you know, it's wasted money.
Okay, yeah. Well, many more questions have come in, so they will need a little bit of sorting, and hopefully we'll be able to speak to you again very soon.
That'd be wonderful. I'd be very happy to do that.
I'm just looking at them already. Where can one buy this device to measure ketones is perhaps one that you can respond to quite quickly.
I mean, they're on my sales at Dr Myhill, but I mean, you go to Amazon and or eBay, and there are endless devices. I got one. This one's about 50 quid, but you can get them for about, I've got them on my website now for £35. So they're very reasonable and an essential tool. They keep you on track. In fact, a very dear friend of mine who lives over the hill there, a very competitive sort of character, I've been badgering him and badgering him and badgering him to do the diet. With that ketone breath meter, he's now seen it as, oh, it's a bit of a kind of a test for me, you know, and he can, and you know, every time he blows ketones, he gives me a little ring. I'm blowing ketones now. So, you know, it's turned it into more of a game. It's, you know, I have to say, there's never been a better time to go paleo ketogenic, and never been an easier time. Foods that are available, you know, the gadgets that are available, make this a walk in the park. You've just got to start the journey.
Okay, fantastic. Thank you. Well, it's just marvelous for us that your book is out as well, your latest book. It is extremely comprehensive. We'll be reviewing it in our next newsletter, and hopefully before then even we'll have you on again. Thank you so much. That was a superb session again. We've got lots and lots of expressions of gratitude here as well that have come in. Can I just mention that Dr. Robert Bransfield, psychiatrist from the States, who's even saved patients from death row by diagnosing them with biomedical causes for their apparently, you know, psychiatric issues that have caused them to, you know, commit various, you know, crimes. So he is an absolutely unique speaker who has agreed to come and spend time with us again on Thursday, the 9th of July at 5 o'clock. So please do take part in that if you can. And after that, we'll have further speakers. So look forward to that. And hopefully this COVID crisis will be over soon and life will be getting back to normal. We will continue with webinars, but perhaps they won't be under the title COVID-19. Let's keep hoping. So thank you very much again, Sarah. Thank you everybody for attending as well, and see you again. Thank you very much indeed. Bye-bye. Bye.